And I really appreciated hearing the international perspective. My question is going to be from more of a U.S. perspective. It's interesting to me when we talk about trying to get people to use vehicles less and all of that. It's interesting to me that there are these other policy decisions from other sectors like charter schools and, urban sprawl. And, I don't know to what extent that is those are factors in more international sites. But could you talk a little bit about how things like and when I say charter schools, I mean no longer do you go to just the school that's in your neighborhood. You can go to a school that's on the other end of the city. And sometimes urban transit or public transit is not necessarily the answer for cities that have grown over the years and they've just sprawled until the metro is super large. And so you don't have a 15-minute city. Does anyone have any information on or have put any thought to the idea of other sectors like education and business, jobs, all of that? How does that play into what we're trying to get people to do, which is use their cars less and just use public transit? That's an urban planning question.
I'll take a first answer. I think you're absolutely right. Thinking about these sectors is critical because they are ultimately the drivers, where the development happens, where the schools settle. And even before the resurgence of charter schools, school districts were largely independent from the city planning department in terms of where they would locate. And as a result, they would look for the cheapest land where they could build the biggest school to exploit economies of scale. And in the end, that meant far away from anywhere, and therefore perpetuating reliance on automobiles and the like. So there's no doubt that that's a huge challenge. My answer to that is thinking about kind of reflecting on this idea of the 15-minute city, that it's actually a movement that had started much earlier and has its origins even in the 1900s. It's thinking about these multiple nuclei of communities. So what we're seeing in California that I think is also initially detected in the East Coast is the suburbanization of poverty. So low-income residents are leaving cities to the first and second rings of suburbs and creating challenges about how do they get around, right? They want to access multiple jobs at unusual hours. And so from the planning angle is how do we bring them in compact places where they have the destinations available so that they don't need to go cross town for every single trip or travel long distances. So thinking about these self-contained communities that maybe are not going to serve every single trip because some of the activities I need to go to specialized healthcare, it's not going to be in my community necessarily, and that's fine. For that, I'll have an option to be able to get there. But most of the daily activities that we engage in, that they are actually available within a fairly short commuting time and maybe through different ways of getting there. Mm-hmm.
Hi, thank you all for these presentations. My question is actually for Professor Benmarhnia. I'm curious if you have other examples of how proportionate universalism can be used for climate action strategies, since I think about that a lot for social services, but it seems hard to apply for climate action strategies, which I typically think of like on the neighborhood or city level, and if you feel like that helps make like more of an economic argument for why that's a better approach.
Yeah, sure. Can you hear me? I guess I don't control it. So yeah, so I can think of one example that I think would be interesting just to use for that specific type of action, and proportionate type of action is about like heat action plans. So, like the way it works, we have heat warning system. In the US, it's managed by the National Weather Services, and when there is a heat action plan, they're going to trigger a lot of actions, including opening cooling centers. So location of cooling centers can be designed in a proportionate way, just to try to think about like over-investing in areas in which we know there will be a lot of kind of intersectional characteristics that exacerbate the impact of extreme heat on different types of health issues. And I think that could be a good example. And this is key because when we analyze the effectiveness of like actions or prevention action for extreme heat, what really makes a difference is really local actions. The heat warning systems, by itself, the fact just that people are going to know that, tomorrow or in a few days there will be a heat wave, whatever the definition that is being used for a heat wave, can actually exacerbate inequality, because people that are going to receive and use this information in a kind of efficient way are probably not people that actually need it the most. So having these local actions that are designed with this kind of equity side of things are going to be quite important. So that would be the example I would use, besides all of the air pollution and transportation, access to different types of amenities like green and blue spaces, etc. But that's just an example I was thinking of spontaneously.
Thanks. I was actually wondering whether you were mic'd, so that's why I was waving. But I do have a question also for you, Professor. The slides went through very quickly. It was a fabulous panel, but packed with information. And I wasn't sure from your slides whether targeted or universal had more health impact. And one of the things that we often use in health departments, and remembering my time, is a targeted universalist approach, where we use a geography which we know has high rates, and then offer an intervention universally to that geography.
Yeah, so the quick answer would be it depends, but in this specific example, like the type of actions that reduce the most inequalities will be targeted. So what we did is really to just like to be relatively realistic by having the same budget. So what we did is, let's assume we have the same amount of investment to reduce air pollution as what we would do based on current regulation, but let's invest it by targeting the most vulnerable communities using different type of characteristics. That is what is going to lead to a higher rate of reduction in inequalities, but the lower benefit at the population level, and vice versa. And then that's why what we argue for is to have like kind of a discussion about that and a tool to have this discussion, because what I want to emphasize is that this conversation most of the time doesn't even happen about what is the priority, and you can't check all of the boxes. So just having a conversation about what for a specific type of policies, for a specific type of community is a priority, I think is important. And then we have all of the tools to help decision making, but this decision and this conversation needs to take place. So that's kind of what I was trying to convey.
Okay, this question is directed at Daníel, but I appreciate any input from anyone in the panel. In your last slide, I think you hit upon something that's a real tension we're facing in developing sustainable mobility systems in the face of climate change, is that we're asking people to give up their cars and use walking, biking, and public transit when the climate's getting more hostile to active transportation. You know, we're seeing heat waves, flooding, extreme weather, more pollution. So you mentioned in your last slide who's responsible for that, but I'd like to back up from that a bit and say, what type of research and data do we need to make scientific progress on this tension that we have to resolve between more inhospitable climates and people moving outside their vehicles?
Thank you. Yes, this points to also another element of the discussion, which are the trade-offs that are emerging in some of our interventions. One of the earliest trade-offs that I can remember comes from the 1990s for air quality alerts, where we were asking people to not drive because the air quality was bad, and as a result, people were walking and taking transit, thereby being exposed to bad air. And so that was kind of, again, the positives versus the negatives that were conveyed before. Indeed, I think there's a lack of evidence of those kind of trade-offs. We need to provide some of the information about the magnitude of the trade-offs, because in some ways they are kind of described very generally, and understanding really if there's a net benefit or a net cost as we think about them. And then to reflect on another point made before, it's being creative about how do we deal with these trade-offs. And there could be kind of solutions that are unusual. For example, asking people to work different schedules, or maybe not travel that day at all. So for some people that might be appropriate and allow us to maybe have a win-win situation. But I do think that there is a lack of evidence about how they're happening at the same time and what is the net impact. And I think that's an area ripe for study. Yeah.
Yeah, if I could just add something, I think there's a lot of interesting ideas about basically bringing in urban tree covers specifically to support active transport. So obviously it's going to get hotter, it's going to get sort of riskier for health to conduct active transport, And so some of these adaptation measures using basically passive cooling and things like this really need to be designed to make active transport sort of a viable option as the climate changes. And so I think that's another very nice example of this sort of win-wins when you look in a much more integrated, multidimensional way of what kinds of actions we need.
Yeah, this is a good question. Huh? Whose fault is this? This is I think we are experiencing the scaling up of the tragedy of the commons, which is if only one collaborate, everyone, the problem is not solved and the situation is the same, and that collaborator is penalized. And what is that about? This climate crisis is telling us that we need to shift the model that we are experiencing since the Industrial Revolution. This is true. I mean, then capitalism will survive and prevail. It will. But we're shifting. Industrial capitalism is there, but we shift for services and knowledge capitalism. And it is still there, but now we need to shift for maybe environmental friendly capitalism that will impose itself to ourselves a new manners to live. If it is a heat wave in the city, no one will be able, the heat waves we are experiencing right now are really weak if we think on the projections and scenarios that we have for 20, 30 years. So no one will leave their houses. It is really a different thing. And we need to start to think about those maybe regulations, maybe positive behaviors, maybe something different from what we are doing now, so that we can actually keep the cities functioning well and a minimal quality of life for ourselves and our descendants.
Thank you. So my question is for Rodrigo. Thank you all for the wonderful presentations, and this is primarily for Rodrigo Perpétuo, and the others can chime in, but it's about couldn't agree more on the issue of making sure that health is part of the guiding frameworks and documents that guide policymakers and governments in the world. And you talk about, or you brought the climate action plan of Belém, and my question is, to what extent health is and health evidence is used in that document, and how can we as researchers enhance the use of evidence for those documents that are guiding, the future?
Thank you, Mariana. So I'll start with the second one, which is Isa. So the Belém action plan, and actually the action plans that we are facilitating and supporting technically, in South America, they bring in the risk analysis what we call arbovirosis, which is focusing on the mosquito, dengue, chikungunya, and these kind of diseases. It is actually our model, and we can, of course, collaborate more to improve our capacities on that sense. Our model is not bringing health on the risk analysis as it should be correlated to the other perils, except for this specific one, arbovirosis. And of course, this reflects at the action plan. Then the actions that we have there are tackling this specific field of health and not bringing health as a central or more important piece of it. And this has to do, of course, with to what we are responding to. And then there comes the diplomatic or the diplomacy piece of it. In my thesis, I studied every one of those agreements, searching for the references that they would have to local governments, to cities, to localizing the policies. And you have general references when you have them. And health is definitely attached to the local government's references at all. And then the consequence of it is that the framework regulations to national governments and of course then to regions, states, and cities is not bringing health correlated to those policies that we need to localize. So the final task is given to the local governments themselves to do the interconnection. And then the funds are not coming with the request to interconnect health and bring health as a key piece of the projects that we are proposing to development banks, to cooperation funders, unless it is a specific health project as you are managing here. So this is, I think, a collective task that we should organize ourselves. Of course, ICLEI has a big responsibility here as constituency leader, but together with you researchers, academy, and of course, all the cities network to organize our pitch and our advocacy piece to bring health as a very important central aspect correlated to climate, urban agenda, and of course, biodiversity.
I think there's a question right here.
I have what feels like a difficult question around the, we talked about it in the first panel, and now we're talking about it now, where you're presenting real factual stuff about climate change and urban health, but then there's people that are gonna continue to be like, this is not real. So I'm wondering what's been your experience presenting this information to leaders that are trying to make change, and at the end of the day, like, what are the strategies that you use to be able to bring those people in? Because we're experiencing that here, where they're like, we're not gonna have a conversation with you because it's not, this is a political issue, rather than it being like, you know, we're all people on the planet that are going to die if we don't make a change. So I'm wondering if you have any tips for us who are doing this in Philadelphia, and then knowing that you're all coming from different parts of the globe, like, everybody's politics are influenced by each other's decisions, right? So the conservatism of the United States is flowing into other places. So what does it mean for that to then be changed? So that's my question. I know that was a lot.
Well, that's a good one. Huh? If anyone knows the answer, please let us know. But what I can maybe bring in is that from the ICLEI perspective, we work with all parties, left, center, right, extreme right. And of course, the extreme right ones, and maybe the moderated right, are trying to deny this agenda somehow. And the key to avoid denial is facts. So if you prove that heat waves is killing people, that heavy rains and flooding is killing people, they won't be against it. And we are actually supporting many right-wing party mayors and governors in Brazil especially, that are working with climate change plans, that are joining ICLEI to have a climate change strategy, and that are willing to collaborate with other cities or states that are going through their climate planning. So I think the answer is try to avoid the conflict. We don't need this conflict because science is there, and this is probably their strength, trying to bring the conflict. If we go out of the conflict and bring the facts with possible answers to that challenges, they will listen.
Just to maybe add something, one of the things that we're looking at in the Catalyze project is how essentially different framings resonate with different target audiences. And so, you know, basically what do you gain with framing climate change as a health issue? That seems to bring many more people, engage many more people to the issue than just climate change as an environmental issue that we have to do something about, because health is very personal. Everyone is concerned about their own health, the health of their families. So really trying to understand how to much more effectively use these kinds of framings, and the health argument is really important there, to get basically engagement and much more sort of acceptance for some of the things that we need to do to basically mitigate and adapt to climate change, and talk about it in ways where you just don't even mention climate change, basically, that these are issues we need to be doing for either health reasons or sort of other reasons. And so I think there's a lot that can be learned. Essentially this is communications research, it's survey experiments, it's generating evidence about how should we be talking about this, and what messages work for which target audiences. And I think this is really valuable information.
I want to complement something that was said. And from my own experience, advocating for funding for active transportation in the US, I think the evidence about Medicare cost savings, that $1 invested in trails saves $3 per person of spending for Medicare, really fell in deaf ears in mostly at the higher levels, sort of congressional representatives, members of the Senate and the House. It's just not their budget, and if you're not in the right committee, they won't really care. And so I think over time what I've learned is that bringing health as the decision point doesn't always work that well, and it's not a winning argument, but what it allows us is to bring other coalition members. So those that do care about health, that maybe didn't know about this information or realize that this is a great opportunity to advocate for what they care for. Bring them to the table and create a broader coalition that then might increase the chances of this legislation passing or being kind of front and center. So I would say that broadening the coalitions and finding the ways through which many different interest groups find a way to latch onto and find their interests represented would be a winning strategy overall.
Well, I think that's a really great way to close out the session, positive note. And I think this was a fantastic session. Thank you all so much.